Well, good afternoon or good morning, depending on where you're signing in from. I'm Mark Leggett from Research Data Canada, and I'm going to be introducing our guest panelists today for our RDC webinar. First, a couple of housekeeping notes. The sessions are recorded and loaded into Research Data Canada's webinar archive. So that means that the audio of the speakers and the slides will be available. We do not record the names of attendees or questions that are entered into the chat. So it's only that audio of the speaker and the slides. Please feel free to type any questions you have at any time when they're raised into the chat window. I will field the questions and ask them in the order that I receive them when our speaker is done. I would also highlight that we're continuing on with the webinar series. Next month, we're having a session on clinical trials. So please check out the RDC site, and would certainly encourage your attendance. Today, I'm pleased to be able to introduce Dr. Kelly Cobey. I had the opportunity to hear Kelly speak about a similar topic at the Canadian Science Policy Conference last year, and I was very impressed with her grasp on the issues and opportunities to improve on research in the Canadian context. Dr. Cobey is a Senior Clinical Research Associate in the Center for Journalology at the Ottawa Method Center, and hopefully she will also speak a little bit about that phrase journalology, because I think it's one that we don't often encounter. In her capacity there as a publications officer, she provides educational outreach on best practices in academic and biomedical publishing. Kelly also consults with researchers one-to-one to provide feedback on research design and report. And she actively contributes to research on journalology topics, including projects related to predatory journals and reporting quality. She's a member of Equator Canada, an adjunct professor in the School of Epidemiology, Public Health, and Preventative Medicine at the University of Ottawa, and an honorary researcher at the University of Stirling. Kelly obtained her PhD in psychology from the University of Groningen in the Netherlands, and again, a unique phrase. She has a master's in research, a master's of research in biology from the University of Liverpool. I had not often heard that phrase, master's of research, as well as a BSc from McMaster University in Canada. And prior to her current post in Ottawa, Kelly worked as a lecturer at the University of Stirling in Scotland and had a Physician Research Fellowship at the University of Paris North in France. So with that, I will pass it over to you, Kelly. And again, just to highlight, if you do have questions, please type them into the chat at any time, and I will queue them up and ask them after Kelly's done.
Great. Thank you so much, Mark, for that introduction. So I'm going to be speaking today about how to reduce waste and increase transparency in health research. Just to start off, I wanted to disclose that I have no conflicts of interest relevant to today's talk. But I do have those affiliations Mark mentioned at the U of O and at University of Stirling. And I'm a member of Equator Canada, as well as an ambassador for the Centre for Open Science. So my role at Equator Canada and the Centre for Open Science, both of these are voluntary roles, but I will be talking quite a bit about the Centre for Open Science in today's talk. So I'm not paid for my role there whatsoever, but where you see that logo on slides, I've taken slides or modified slides from the ambassador slide deck pool that we have there. Okay, so let's get started. In terms of today's talk, I had 3 key learning objectives. The first is to understand the problem of waste in health research. Then I want to discuss how to enhance the transparency of health research, and then conclude by discussing a little bit more broadly how we can move towards open science. Okay, so I'm going to begin the talk with highlighting a problem in biomedicine, and it's a bit of a negative note to start off on, but I promise that we'll be addressing solutions to this problem as we move through the talk. So the problem I wanted to raise is that in biomedicine, there's a combination of a strong bias towards statistically significant findings and flexibility in data analysis and results reporting, and that together these things can combine to lead to irreproducible research. So what does that mean? Let's break that down a little bit. Strong bias towards statistically significant findings. What I mean by that is that the vast majority of research findings that get published have statistically positive effects or p-values. Here you can see a study by Finelli in 2010. On the y-axis, you see the hierarchies of the different disciplines of science, and on the x is the proportion of papers that report a statistically significant p-value. And we can see that across all of the disciplines, that significantly more than 50% of papers have statistically positive p-values. And this is statistically improbable. If we look at disciplines such as psychology at the very bottom there, which is the discipline that I've done my PhD in, more than 90% of studies published have p-values that are statistically positive. So when you see this, I think that this should be alarming, because statistically this is improbable. And what it suggests is that there is at least a pool of studies that are being conducted that never see the light of day, so never go on to be published. And these studies are likely small studies. They may be studies that favor the control. And overall, what we see here is a publication bias across biomedicine, but across other disciplines in academic research as well. And I just want to highlight that there are many reasons for why we see this problem of publication bias. One is, of course, that journals like flashy new results, perhaps, and that editors and peer reviewers want to publish studies that are groundbreaking or novel. However, another reason there's evidence is that researchers actually just don't take the time to write up negative and null results. So one of the key reasons why we have publication bias is because researchers don't actually submit papers without statistically positive p-values for peer review at journals. And together, this idea of publication bias, I think, is really concerning from my own perspective as a biomedical researcher. It's concerning because it means that we have an incomplete evidence base to make our evidence-based decisions from. So as an example, I sit in a center, a knowledge synthesis center at the Ottawa Hospital, where the folks I work with are constantly doing systematic reviews. So systematic reviews take a body of literature on a particular topic, and they synthesize that to look at particular outcomes. But it's a case of garbage in, garbage out for these reviews, because if people are not reporting all of the evidence, they're not able to synthesize all of the evidence. And these systematic reviews, at least in biomedicine, often directly impact things like clinical practice guidelines. So the potential for these to be biased or incomplete is really strong when we see evidence missing from the literature. Okay, so back to our problem in biomedicine, moving on to the sort of second aspect of the problem. There's flexibility in data analysis and results reporting. So what I mean there is that essentially there's a lot of individual latitude for a researcher designing and reporting their studies. So they can choose methods based on their own decisions without sort of any form of peer review or vetting at that point. And they can also choose if and what aspects of their manuscript to publish. And I think that to an extent that this is problematic, and I'd like to illustrate why through Gelman and Loken's Garden of Forking Paths analogy. So essentially, what this suggests is that an individual researcher can ask a simple question or a hypothesis. So they might ask, does X affect Y? And they will start out here where that orange star is and end up there where that blue star is based on a particular design. However, if after conducting their study, they have the opportunity to analyze their data, they have a number of decisions that they can make. So they can decide, am I going to control for outliers? What other controls might I use? Will things like sex and gender be considered in my statistical model? And based on different decisions, they may end up here or elsewhere altogether on this garden of forking paths. And it's really problematic because there may be implicit or explicit biases that researchers have that lead them to choose statistical methods or analyses that are more likely to yield significant p-values. This is because we live in a system where the incentives and rewards are based on publishing in academia, and we've just discussed how studies with statistically positive p-values are more likely to make it into literature. The Garden of Forking Paths analogy also works for issues beyond statistical analyses. So it works for things like reporting issues. So for instance, as a researcher, I decide to study a particular topic. I might say I have a primary outcome of X and a secondary outcome of Y. But the problem is that when it comes to reporting, I have the latitude to decide what outcomes I will report. So for instance, while I have data on both X and Y, I may only report the data on Y. Or it could be that I reprioritize outcomes. So for instance, in a clinical setting, we design and statistically power our studies around a primary outcome. So it may be that my primary outcome is X and my secondary outcome is Y in my design, but when it comes to reporting, people reprioritize these outcomes, making it seem like Y is the primary outcome and X is the secondary outcome, which is problematic if the study isn't powered to detect Y. So this sort of issue in terms of what gets reported and the quality of completeness or transparency of reporting isn't something new. So back in 1990, Kay Dickerson, who's at JAMA, is now based at Johns Hopkins in Baltimore, she stated the following. She said, "There seems to be no formal guidelines in science as to when study results should or should not be published. The decision as to what to include in a publication and whether to publish is largely personal, although dictated by the fashion of the times to a certain extent." So I think we're basically in the same situation as Kay described many decades ago. Okay, so what does this lead us to? Well, the combination of strong bias towards statistically significant findings and flexibility in data analysis and results reporting can lead to irreproducible research. So this idea that there's a irreproducibility crisis in science is hotly discussed in the both lay press and in the academic literature as well. A study by Nature that surveyed more than 1,500 researchers found that just 3% did not think there was a reproducibility crisis. So in general, I think there is concern about the methods that we're using as scientists and the way we report our results and the biases in both of these areas. You can ask, what are the consequences of irreproducible research? And I think there are many, but to highlight just a couple, from a biomedical perspective, the perspective that I take, you can ask, why do patients partake in research? And I think, well, if patients knew that the vast majority of clinical trials never see the light of day or go on to be published, and that those studies that do get published are often methodologically fraught with errors or reported so deficiently that they're not actually usable for clinicians to apply interventions, or they're not usable for researchers to build upon, I think that they'd feel that we were doing them a disservice. And I think that we owe it to patients partaking in research to ensure that we are not falling short of meeting these required standards. Another perspective, we could ask, why do governments fund research, or why do researchers study health topics in the first place or devote their lives to particular clinical illnesses? And I think that in general, governments and researchers, they do this for the same reason patients take part in research. They want to better society, they want to reduce disease burdens, and they want to help those in the future. And I think that the efficiency to which we're doing this is vastly reduced if there's bias in our design and in our reporting. So together, these problems of issues with design and issues with reporting create irreproducibility, or what we like to refer to as research waste. This is a model from McLeod and colleagues, and what they highlight is the fact that the research process is actually a continuum. Starting off with the research question that you asked, you have to ask something that's relevant. Ideally, you're asking something that's not recently been studied in the same model. You have to design a study appropriately. You have to choose analyses that are appropriate for your particular study as well. You have to efficiently manage and regulate your study. And then at the end, you have to produce a fully accessible research report that's unbiased and usable. But if at any stage across this continuum, you fail to uphold best practice standards, it contributes to research waste. And this research waste across the continuum is actually cumulative. So errors at each of these stages add together to produce higher amounts of waste. And it's estimated by McLeod and colleagues that at least in clinical biomedical research, upwards to 85% of money spent on biomedical research is wasted due to deficiencies across this continuum. So a lot of negative news about the current state of biomedical research and the lack of rigor and problems with bias. I will say here that this problem in this talk is focused largely on biomedical research, but there's a lot of evidence to suggest that these problems are quite prevalent in other academic disciplines out with biomedicine. So one might ask, what is the solution to the problem? And I think that's a complex question, but I think at least in part, transparency will help resolve this issue. And I think that we're going to need concerted action amongst multiple stakeholders, but moving towards a more transparent and open science is definitely something that I think we need to do. So in my talk moving forward, I'm going to talk about some potential solutions to increase transparency and reduce waste of health research. And I'm going to be focusing on the end phase of this research continuum, namely the publication aspect. So publishing fully accessible research reports that are unbiased and usable. And the reason why I've chosen this particular end phase of the spectrum isn't because it's most important, but it's just the sort of vantage point that I take as a member of the Center for Journalology. So journalology, it's a bit of a mouthful. It's the study of publication science. And our Center for Journalology is directed by Dr. David Mower. And we study a lot of topics related to the quality of reporting or lack thereof of biomedical research, and look at developing interventions and tools to enhance the quality of reporting to make reports more usable. So I'm focusing on that aspect today, but there are equally many topics, other phases of the research continuum that could have been focused upon. Okay, so one key point here in terms of how we can rectify the problem that I've raised in terms of bias in publication bias altogether and bias in what gets reported and methods is to mandate transparent registration of studies a priori. So what I mean by that is that I would propose that researchers, before conducting a study, draft a protocol that is detailed, and they create a time-stamped read-only version of that plan or protocol before they begin data collection. So it would contain the hypothesis, the data collection procedures, so detailed methodologies, the measures that would be manipulated and measured, and the statistical models that would be used within the research. So basically, it's a plan of what's about to happen. Subsequently, what we could do is, if this was done, we'd have a record of what was planned. When the study was completed, we would know what was done, and we would have a way of distinguishing between 1 and 2. So distinguishing between what was planned and what was done. By nature, research is inherently complex, so it may be that we deviate from our protocol, but what this system would allow would be a means for us to audit and be transparent about when and why those deviations occurred. And we could provide the supporting evidence for 1, 2, and 3 to indicate our decision making. I think that this would be a really important step for a number of reasons. Some examples of what registered protocols would fix. It would fix issues potentially like publication bias and selective outcome reporting. So for example, right now, the fact is that many researchers conduct studies on various topics, and we have no record of the studies that have been conducted. So if we created protocols that were time-stamped, there would be a way of looking at what was done and then an expectation, and we could audit to see that what was done actually had results reported, and that those results that were reported are true to what was done. So we'd want to see the outcomes of all of the measured variables, not just selectively reported outcomes such as those that were statistically positive. Another thing that registered protocols could address would be p-hacking. So this is unreported flexibility in data analysis. So sort of from the example of the garden of forking paths, we've talked about how depending on what you control for and what you add to your model, it may lead you to different answers, some of which are statistically significant or more statistically significant, so to speak, than others. So if you had a plan a priori of what your model would be, we could ensure that people aren't sort of fishing through the data trying to find effects that may not necessarily be robust. And finally, it would also address issues like harking. So that's hypothesizing after results are known. So we would expect a statement a priori of the hypotheses, and researchers would then, if their data didn't support that, not be able to change their hypotheses to match the data. And if they're doing exploratory research, that's fine too, but we would know that the work was exploratory from its inception. I want to highlight a special type of pre-registration of a protocol, which is called a registered report. It's a really interesting idea. So essentially what this is, it's when your registered protocol undergoes peer review before you've collected the data and the results are known. So some journals actually will peer review your protocol and or publish it or just peer review it and accept it, so to speak, with the idea being that subsequently, if they accept your protocol based on the design being robust, that if you uphold the methods that you set out to uphold, that they guarantee to publish your manuscript irrespective of the statistical outcomes. So the idea here is that your methods are being reviewed more heavily, and that subsequently this will address issues like publication bias or selective outcome reporting because there's a record here. Pre-registration importantly makes the distinction between confirmatory research and exploratory research. So confirmatory research is when we're actually testing an explicit hypothesis, and exploratory is more for hypothesis generating. And why this is important is because without having registered protocols distinguishing the type of research you're doing, researchers might present exploratory results as confirmatory. And this may increase the chance of them getting published, but it's at the expense of the credibility of the results. So I think that this idea of pre-registering is a good one that we need to be moving forward with in multiple disciplines, but certainly in biomedicine. I think you can, at this point, make your research stand out by doing this. Certainly if I peer-reviewed a paper that had a public record of the protocol that they made available before they started the research, I would see that as a very positive aspect or strength of the paper. I think you can reduce waste because it allows for your work to be audited. And in some cases, it will help you comply with policies for certain particular research designs, at least in biomedicine. So as an example of that, we have clinical trials. So in Canada and internationally, in general, clinical trials must be registered prior to the recruitment of the first participant in a publicly accessible research registry. And then subsequently, our TCPS2 framework requires that results be shared in some capacity in a timely fashion after the trial has been conducted. The rules and sort of regulation around trial registration and results reporting within Canada are not as strict as, say, in countries like America, but I think we do have some framework in place that requires this. However, having a framework in place or a policy is not enough. We need to actually ensure that we're auditing our policies and that these policies are being successfully enforced. So as an example with regards to clinical trials where registration of a protocol, so to speak, ahead of time is required, we see that this is being done suboptimally in terms of registration, but even worse so in terms of results reporting. In a study by colleagues at Oxford led by Ben Goldacre, what these folks did is they looked at 5 leading biomedical journals and they checked all clinical trials within a certain time period published in those 5 journals. In total, they checked 62 trials. And what they checked them for is whether or not they were true to what they had registered in their clinical trial registry report. So did they report all of their outcomes? Did they add any new outcomes? And if so, where the discrepancies lied. And of the 62 trials that they checked, again, these are in what most consider to be the highest quality biomedical journals in the world, just 9 were perfect. And 317 outcomes were not reported in those 62 trials, and 323 new outcomes were silently added. So this appears to suggest that, at least there's a mechanism for audit, but at least at this point, we haven't been upholding the standards to the level that I think would be optimal. In response to this data, Ben Goldacre and his colleagues sent letters to the editors of 53 various papers. Some of those journals published the letters, and there's been some very open discussion about that. in related work, they created a trials tracker tool based out of Oxford that actually reports on the number of trials at institutes that conduct a significant number of trials globally, and the proportion of those trials that don't have results reported. So I think that tools like this and automation will help us enforce these much needed policies more strictly. Another example of study registration outside of clinical trials pertains to systematic reviews. Now here with systematic reviews, it's not a sort of strict requirement of policy, but there's a cultural norm that is very strong. So at least in biomedicine, when researchers set out to do a systematic review, they often register a protocol in Prospero, which specifies what they've set out to do, and then they refer to that in their published systematic review at a later date. When it comes to other research designs in biomedicine, there's no requirements for by and large for researchers to create protocols or to make these publicly available. In contrast to sort of the framework around it being very lax, there's actually a lot of great opportunities to do this if you're looking to do so through sort of your own push to make your own work more transparent and open. And one tool that you can use that's publicly available is called the Open Science Framework, which I mentioned is from the Center for Open Science. And essentially you can post protocols or register protocols on this platform free and immediately to make them publicly available, to create this sort of record of what you set out to do. So just very briefly, I'll highlight what the Open Science Framework platform looks like. It's a tool for sharing files both within a group and externally to other people or publicly. So you can see that there's lots of different sort of boxes here where you can share files or have your work cited or various tags that you can use. Our group has used the Open Science Framework to make some of our observational study protocols available, and subsequently all of the data and materials related to those studies we've deposited on the Open Science Framework. Initially, we deposited there so we as a research team could access and draw from those files, but subsequently at the time of publication, we made all of the files publicly available. And what's really neat is that there's analytics available from the Open Science Framework. So we can see after, for instance, when we published our study, that people are actually going in and downloading various documents such as surveys or materials or data that were part of our study and reading those. And it's possible to actually cite these aspects as well. I just wanted to highlight that for those who are in a biomedical discipline, the Open Science Framework is not PIPA or HIPAA compliant, so you can't have personal health information on there. Lots of research institutions have institutional repositories. This is another venue for those who have academic affiliations to deposit protocols ahead of time. What's important with these repositories is that they're indexed, so that your protocol is actually going to be searchable and citable and will be permanently archived. One concern I think a lot of people have with this idea of pre-registration or hesitation for moving forward and incorporating into their standard operating practice is that they're concerned they might be scooped if they do this. And I think that by and large, this concern is much greater than it needs to be. Firstly, by creating a protocol that is time-stamped and pre-registered, you have initial claim to that particular design. And I also think that most often, by the time you've pre-registered a study, you're far ahead of any possible stooper. So for instance, many of the studies we do require research funds, they require personnel or equipment, and it's unlikely that those could be mobilized from another group particularly rapidly. However, if this is still a concern, or if you're working in a particularly fast-moving area and you are worried about being stooped, you can always embargo your pre-registered protocol, meaning that it won't become publicly available until the time of publication, but it will nonetheless provide a record of what you said you would do that you can refer to in your publication at that time, and it's time-stamped. In terms of movement towards open science more broadly, I've talked today about problems in biomedical research and ways to reduce waste, namely through creating or mandating a system of required registration of protocols that could then be audited and that we would audit and enforce through policy more firmly. But I want to talk about some actions that have been taken within the Canadian context fairly recently with regards to open science more broadly. So these are just two examples. There are many possible examples, but I highlight them because they're recent. So for instance, the University of Toronto, some genomics researchers based there have committed to publishing their lab notes in real time to make their work transparent and publicly available for others to use and build upon immediately. And we also have a neurological institute based in Montreal that has the claim of being the first open science institute in the world. And they have the objective to expand the impact of brain research and accelerate discovery of groundbreaking therapies to treat patients suffering from a wide range of devastating neurological diseases. So they, for instance, are not patenting their work, and they make all the data and materials from all the studies that they're doing publicly available immediately so that others can build and use that, and that they can progress neurological research forward at more rapid rates. There are other examples of open science movements globally and certainly within Canada. These are just two. But I think what these are great is that they highlight the fact that for this to take off, we need some early adopters, and we need to measure quantitatively the quality of these programs and these initiatives. So creating evidence on the effectiveness of, for instance, the Neurological Institute in Montreal being open, I think would provide a more rationale for other institutions who might be more hesitant to be an early adopter to adopt these practices when they can see the actual impact it's having on healthcare and the impact it's having on other metrics used at research institutions. It's not just research institutions that are adopting more transparent practices. Journals and publisher policies are also changing and moving us towards more transparent research results reporting and results data sharing. So as an example, a number of psychological journals have introduced these types of badges that you see on your screen. And essentially researchers can earn a badge on their published article when they make their data available or their materials available, or if they had a pre-registered protocol ahead of the start date of the data collection. And what they found was that when they introduced the opportunity to earn these rewards at one journal, but not at other comparable journals, you can see in the dark black there, the dashed red line is when they introduced the opportunity to earn these badges, and that we can see subsequently over time, the rates of sharing increase substantially. So this is, I think, a very cost-effective, simple method for increasing transparency and data sharing. Journals and publishers are also adopting top guidelines. There's now top 2, but these are transparency and openness promotion guidelines that journals are seeking to sort of increase their own levels of. And there's a number of different categories, but amongst that are things like replications, data transparency, and pre-registration of studies. So journals are salient of their role to an extent in moving this transparent open science paradigm forward. Journals have also instituted things like declaration statements. So for instance, Altman and Moore and BMJ suggested that every lead author affirm that the manuscript is an honest and accurate and transparent account of the study being reported, and that no important aspects of the study have been omitted, and that any discrepancies from the study as planned and if relevant registered have been explained. So we have to make a number of different statements when we submit a manuscript. For example, all of our co-authors are aware of the submission. It's not been submitted anywhere else. These types of simple declarations may increase the rates of transparent reporting as well, because it's making it salient to the journal authors that this is important. Journals are also introducing things like authorship statements. So the one key example is something called credit. And basically it breaks up the various aspects of a research process, and you have to assign a contributor or contributors to each of those various aspects to be transparent about who's done what and who's responsible for different aspects of a study. Again, this can be used for things like discerning credit in terms of putting this type of stuff on your CV, or acquiring particular skills, providing evidence for that, but it can also be used to audit particular aspects of studies. So just to wrap up, one might ask, why would we follow these transparency practices at all? There's no mandates for most studies. We're not required to do this in biomedicine except for with clinical trials, and even then we're not really being enforced to do this. Well, I think that as researchers, we dedicate our lives to a subject. I know personally that I would want to ensure that the work that I'm doing is having the highest possible impact. And I think that it's important that work that we're doing can be audited and that we prevent unnecessary duplication due to issues like publication bias or selective outcome reporting. I think that by making your work transparent, you're more likely to have usable work, because by creating these public records and knowing that you could be audited, I think people hold themselves to higher standards that they should be holding themselves to irrespective of whether things are public. Another thing that I think is really positive about transparent pre-registration of studies is that it provides an open access account of the work. And subsequently, if you share the results and the materials in an open access format, this is really positive because not all publications are open access. And I think particularly as biomedical researchers, for example, if you're studying patients or involving patients in your work, patients should have access or have the ability to access the outcomes of the trial they participated in. But currently, because most trials don't actually get published, and those that do may not report all outcomes, or they may be behind a paywall, patients may not actually have that opportunity. And I think that another reason why we should follow transparency practices, specifically registering our studies a priori, is that increasingly it's becoming a requirement, or at least it's becoming encouraged to share data and materials. So there's new guidelines and policies coming out from various organizations very frequently that are being updated. And I think it's not a case of if open science and data sharing will be mandated, but in my view, a case of when that this will be occurring. So we might as well adopt those standard operating practices now. I think that data preservation is not new, but we continue to move towards better means of doing this and facilitating this in a more open and transparent way. And I also think that transparency is important from a fiscal perspective, because it creates a complete comprehensive data, materials, and management plan, and it provides sort of continuity of access to the data that is subsequently generated. So I've gone through a lot of problems in biomedicine, and I've talked about one particular solution and how we need to enforce that solution of registration through policy and through audit. But I think it's important, before I close out, to discuss a little bit about the climate that we as academic researchers, or researchers more broadly, often sit in. And that is that the system of incentives and rewards in academia often creates this publish or perish mantra. So researchers face a pressure to publish in their day-to-day, a pressure to publish often, pressure to publish in particularly impacted journals. And in general, I think that institutions and even funders often value quantity over quality. So things like the number of publications end up being more important than the quality of the research being produced. And I think that that's really problematic. And I think we need to think about ways we can incentivize and reward transparent, open research practices, because currently I think a lot of researchers are sympathetic to things like writing a protocol and registering it publicly, but they're not rewarded or evaluated on that in any capacity. So for people who may feel that they're already taxed or spread very thinly, they may see this as an additional barrier or task that they don't have time for, especially if it's not going to get them tenure, it's not going to get them promoted, it's not going to get them hired. And I think that, in my view, the system of incentives and rewards that we have in academia actually promotes waste, and it promotes cutting corners, and it does not promote transparency. And I think we need to look at that system and see how we can develop responsible metrics that measure things like transparency and quality of research and quality of research reporting in order to assess these things as part of tenure and promotion and other aspects of hiring. One organization or declaration that is relevant to this discussion is something called DORA. It's the Declaration on Research Assessment. And it's an initiative that calls for institutions to move away from the impact factor as a means of assessing researchers. So the DORA declaration has been signed by literally hundreds of institutions across America and internationally. And I think it's a good first step. The question I think I would have is what are they moving away to, and how are we going to ensure that that's an evidence-based metric to ensure the highest quality research is produced. But I think that it's important that this issue is recognized in context to the initiative to move towards transparent and open science. So that's all I have for my talk. So I'm happy to take any questions, and thank you all very much for your time.
Well, thank you very much, Dr. Cobey, and I would repeat the comment I made to you after your Kelly and I both presented in a kind of a lightning talk session at the Canadian Science Policy Conference last fall. And at the end, I commented that Kelly's 5-minute and extremely lucid presentation, which had a number of elements that were also in this one, is one of the best presentations I've heard on this issue, and having this kind of both policy and practical and a kind of content coming from a researcher like Dr. Cobey, I think is particularly compelling. And I'd almost like to suggest that this kind of presentation be required viewing and reading for any new starting researcher, whether biomedicine or otherwise. So we have a couple of questions from the listeners. I have one or two myself, but I'm gonna field these first. First question is, do you need to ask permission to register protocols in the Open Science Framework from your REB?
Well, thank you so much, Mark. And the question is a very good one. I think that in general, that is something that I would state in my REB application, is that the protocol, and certainly if you're going to make the data and materials available afterwards, will be made public on the Open Science Framework. We've never had any issues with it whatsoever, but it definitely would be something that you'd want to get through REB, in particular if it's the actual data and materials you're sharing.
Thanks, Kelly. The next question, and you may, if you're able to view the chat on your side, you may want to mine it because I'm going to summarize it. There's a number of questions here, but essentially the individual is asking if you could speak to, again, the registered reports, and in particular how they're reviewed and how any post hoc findings are linked to not just the registered reports, but the primary outcomes. Is there additional rich metadata that is contained in these submissions that would allow that kind of linking and more detailed analysis of the outcomes? So that's the general question.
Yeah, for sure. So in terms of the review process depends a little bit on the journal where you're submitting, whether it's sort of double blind, blind, or open. But in most cases, it's quite similar to if you were submitting a manuscript. So it's going to first experience editorial or internal review. If the editor subsequently decides to send a manuscript out, it'll have external review by probably 2 or more researchers in your field, and you can get feedback on that actual protocol ahead of time. So it's not necessarily that they'll accept the protocol immediately as is. You may have to make some renditions and changes, but eventually once it's accepted, if you carry out that work, they will or they seek to uphold that they'll publish it irrespective of outcome. If there's additional analyses that were done, I think that's absolutely fine. The big thing here is that they are clearly labeled as being post hoc analyses that were not registered in the report. So there just needs to be a transparent distinction of which analyses were planned and which analyses were not planned. And the protocol is then linked to the published manuscript. So researchers reading the paper, or members of the public reading the paper, have access to all of that.
Great, thanks, Kelly. And maybe a kind of another question emerging from that, or part of the original question. When you submit to these repositories, a registered report, is it safe to assume that they're all publicly accessible?
Yeah, all of the ones I know of are definitely publicly accessible. So the big push with clinical trials, the common repository that folks use is clinicaltrials.gov, which is based in the States from the National Institutes of Health. And that is a public registry. Certainly in Canada, TCPS2 requires it to be a public registry. So they're all public registries. The results reporting isn't done to a particularly high standard, which is regrettable because I think it would be useful to have on such registries like lay summaries so that there were not only results, but that there were lay summaries for the public to access about particular studies.
Great, thanks. One of the questions that I had is related as I was listening to you talk about the pre-registration piece, it occurred to me that there are elements of overlap between what in the data management community is typically called the data management plan. Mm-hmm. And I would say a big difference between the two is one focuses on the data outputs and the pre-registration clearly focuses on the protocols and what's being or going to be done in the research. But it seems kind of an exciting possibility for me to find a way to not merge those two things, the data management plan, which is typically now required or asked as part of a submission for funding, and these pre-registration reports. Do you have any thoughts on that or comments on the data management plan intersections?
Yeah, I think that in general, some of the DMP tools that have been developed are sort of very much in line with what needs to be developed or which could be developed for protocols or more specific to the analyses. So it definitely could be something that is joined together. I think that in my view, having sort of standardized ways of registering and standard sort of formats to fill out about a study tends to be positive in terms of an audit perspective and ensuring things are done properly. We need to balance that with the fact that research designs are complex and there needs to be consideration of the creativity and different aspects that may be unique to particular studies. But I think in general, a tool like that would be a useful starting point, and it would be something that we could actually train researchers on, because so often the types of mandates that are imposed either by funders or by journals or by institutions, they're imposed without any support structures in place. So for instance, now researchers are supposed to register their trials. How do you do that? Where do you do that? How do you report your trials? When do you have to do that? We need outreach and education to support that, just like we'll need outreach and support to help researchers to create protocols that are actually useful. Because if you're not describing your methods or your analyses or your data management plan in sufficient detail, well, it's not actually replicable and it's not actually auditable. And it doesn't really help us in terms of looking at what you said you would do and what you actually did if it's sort of lacking detail, because then there's latitude to discern what you actually set out to do.
Yeah, and hopefully coming to your point about all the questions that one asks when making clinical trial information and data available, I think it's a nice segue to the RDC webinar for next month, which will have colleagues from St. Michael's in Toronto and the Canadian Clinical Trials Centre in Ottawa doing a presentation on clinical trials in general and more specifically the kinds of policy frameworks and actions that can be taken at an individual institution like St. Michael's. Couple more questions. Where do the repositories, and I'm assuming this is referring to the pre-registration repositories, get indexed?
It depends on the repository. So for instance, in biomedicine, it would be relevant that it be in Medline or PubMed, places like that. But in other disciplines, it would be different. But I think what is important is that they're indexed so that people can search for them and cite them and find them readily. And also that they're archived so that it's a permanent record, so that it's not here today, gone tomorrow, so to speak.
Yeah, and I would add to Kelly's response, a particular interest to Research Data Canada is this question of the FAIR principles and making the findings from research widely accessible. And part of that is facilitating a conversation nationally around how we can ensure that all of the outputs of research, whether they're pre-registration reports or final outputs or data sets, can be sufficiently described that they can be automatically linked to create that kind of network of related research output. So there's a lot of interest, I think, in responding to that opportunity and that challenge. Maybe one final question before I wrap up from the attendees. And to some degree, Kelly, I think you've responded to this, but the question is, public sharing and opening of data for reuse are essential if we are to continue to reduce research waste. Can you please comment?
Yeah, I agree. I think that where possible, we should be moving towards transparent, open sharing of data and materials. So things like surveys or screening templates that we're using. I think that there's good evidence to suggest that, for instance, when it comes to patients, patients are for the most part quite happy for their data to be made publicly available in an unidentifiable format, and that I think that sometimes we're concerned about what people might think and if they would be happy with that. But it's about education and awareness on both sides, and I think that many citizens are happy for their data to be publicly available in such a format. And I think that it's just a question of sort of what side of history we want to be standing on as an organization, as a government, as researchers. You know, I think that this is coming. There may be particular types of data that will not be publicly available that require, for instance, research data requests. But I think in general, much more data than is currently publicly available can be and will be in the future. And I hope that movement is quicker rather than slower. But I think that's what we're going to see.
Thank you, Dr. Cobey, for those final comments. And I would highlight, as someone who has a family member who's a patient partner in two Canadian health research projects, her experience is that, as Dr. Cobey highlighted, most patients would be probably horrified if they felt or found out that the results of their efforts in terms of contributing to that research was not shared and made accessible to health providers. So thanks again. Everybody who's registered for today's webinar will receive an email when the archived copy is publicly accessible, and that will also be. We'll make sure that gets tweeted and more generally, and I would encourage you to share it through your networks, because as I suggested, I think this is a very compelling example of best practices approaches to research. I would also highlight, just as a final comment, some of the things that Dr. Cobey discussed in her presentation, I think can be broadened out into a more general context beyond just health research. Research Data Canada is part of Canary, funded by Canary, and Canary recently launched a research data management funding program, and the first part of that two-part process is a community consultation to get feedback from the Canadian research community as to what they feel are the important gaps and or opportunities in the research data management ecosystem in Canada. I would certainly encourage anybody who feels that they could contribute to that conversation to create a submission. You can go to canary.ca/RDM and access the information both in French and English. And the deadline for submissions is February 15th, so there's still a fair amount of time. And those submissions will then be used by Canary's Research Data Management Advisory Committee to put out a call for proposals up to $3 million in funding to help fill the gaps in the ecosystem. And that funding call will probably be launched in May. So encourage those who have something to contribute to do so. And again, thank you, Dr. Cobey, for your presentation, and thank you to those who attended for your questions. And I look forward to hearing any comments that you may have or suggestions for future webinar topics.
Thank you so much. It was great to be here.
All right. Thanks, Kelly.